All right. Many years ago, my grandfather went in for a non-life-threatening operation at a hospital. It was successful, but a week later, both he and every other patient in the surgery ward that week died. So, like my grandfather, I'll start again. So, many years ago, my grandfather went in for a non-life-threatening operation at a hospital. It was successful, but a week later, both he and every other patient in the surgery ward that week died. Why? Due to a hospital-acquired infection, most likely from poor hand hygiene. So like my grandfather, over 700,000 people each year in the US alone are afflicted by these infections. So time and again, poor hand hygiene has been proven to be the #1 cause. However, despite this, would you be surprised to know that only about 70% of healthcare workers actually clean their hands properly, and only about 80% clean their hands when they're supposed to. As a result, only about 7% of healthcare workers actually have properly cleaned hands. Hi, my name is Sam of HyGenius. We've created a new category, proactive hygiene management, to quantify, automate, and improve hand hygiene via monitoring, instant feedback, and analytics to prevent infection spread and thus prevent others from losing their grandfathers. So our flagship stations leverage our proprietary and patent-pending technology to tackle this problem of poor hand hygiene, using computer vision and deep learning to quantify and improve hand hygiene by monitoring every event from start to finish, and are able to link both compliance and performance metrics to every individual user. Additionally, our system provides immediate personalized feedback and training to users, and the metrics collected can be aggregated and used to inform quality and patient safety on how to improve hand hygiene in facilities to reduce infection spread. So far, this is something that facilities have proven they want, as we have 2 pilots, multiple letters of intent, and over 20 facilities interested in piloting and potential customer relationships. Other milestones include winning the UC Davis Plasma's Demo Day, dozens of customer reviews, and a non-provisional patent filed. So our upcoming milestones are the completion of 5 proof point pilots to quantify impact and prove value, taking the feedback that we get from these pilots to get to MVP and paid customers, and raising a seed round in funding. So far, we've been able to find success in captivating stakeholders when we actually get to speak with them. Getting these meetings is the hard part. So from our successes, we found that the decision makers and the potential champions are going to be the directors of infection prevention, quality, and patient safety in hospitals, and administrators and executive directors of nursing, post, and subacute facilities. Our other ask is expertise in healthcare. So navigating this market can be quite tricky, so anybody who's done so before to have as a resource, that would be invaluable. Expertise in biz dev, marketing, and thought leadership will also help us develop our materials to better inspire those that we speak with to take action. In conclusion, hand hygiene needs to change, and with your help, HyGenius can make that happen. Thank you. Yeah. Sorry about that.
No, it's good. Sure. Sam, great presentation, and I appreciate you taking, personal experience with your grandfather and actually doing something about it.
Yeah.
One of the things that in looking at the technology, there's always a psychological effect of a patient seeing a physician or patient care provider wash their hands in front of them. So I see this as something potentially that's sort of behind, it's not in the patient room, but it's in an area prep outside. Is that where you're looking at the placement of these type of devices, or?
It can be both. I'll actually bring up an example of exactly what you just mentioned. So one of the places that we started our pilots was in a nursing facility. So when I was testing this out, this was like in the main thoroughfare hallway. And oftentimes, a lot of the patients go out into the hallways, stretch their legs, walk around, et cetera. So one of the patients saw that we were testing this out, and he asked what it was, and I explained it to him. And he was elated by this. He even told me, and I quote, "God bless you, sir." So, part of what we'd like to do is actually integrate into that patient care environment as well. So a lot of hospitals, they actually have policies in place where they say, when you walk into a room, be rubbing your hands. Even if you've already cleaned them beforehand, we want the patients to see that you are cleaning their hands. So even though this might be like in the hallways or at a nursing station, we do want it to be more visible. At the very least, every patient room has, every 2 patient rooms has at least 1 sanitizer station between them, and often a sink in each room, or a sanitizer station in each room. So the idea is that we would have a station either between those rooms in the hallways or in the room.
That's great. Is there data collected on the system to allow tracking of compliance, not necessarily penalizing the patient care provider, but actually encouraging and a metrics of data?
Yeah, so this is going to depend on the facility themselves and their preference and what they're able to do with the nursing unions. But the idea is, at the very least, what we can collect is location-based data. So we can say, in this unit, this is the amount of hand hygiene that took place. And then you can sort of correlate that with how many patient visits there were and sort of get a rate. So that's bare minimum. On the opposite end of the spectrum, we would actually be able to have tracking badges that they would wear. It would use passive Bluetooth low energy to actually be able to link those compliance metrics to that individual. And same with the performance metrics as well. So you can tell how well this individual actually cleaned their hands, where they did that, was it before or after visiting a patient, et cetera.
Great presentation. One of the unique things that I haven't seen in hand hygiene systems before, when I was used to work in health systems, that is different here is most systems like hand hygiene systems actually only check whether hand hygiene was performed. Sounds like your solution also checks the quality of the hand hygiene performed. Which
so it's not just enough. Well, first of all, you have no way of knowing. So the compliance systems measure yes, no, is sanitizer actually dispensed? It doesn't measure whether people actually clean their hands or not. So they could just rub it on their pants and walk away, and you'd have no way of knowing, but it would still register as a compliance event. Second point is compliance isn't an end-all, be-all. One of the hospitals that we spoke with, they had in one of their units 100% reported compliance. It had an outbreak that lasted over a year. So that shows that actually cleaning your hands properly is just as important, if not more so.
Great, thank you. We can talk more. I know we ran out of time, but we can talk more later.
All right, thank you. Appreciate it.